Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Cough. Cough is a reflex act of forceful expiration against the closed glottis. So, when someone tries to expire against the closed glottis, then cough occurs. The main use of cough is the clearing of airways. So, clearing of airways is the main importance of cough. So, if there are any secretions which are present in the airways, and if there is any foreign body which is present in the airways, or if there are any secretions in the airways, so all these are cleared by coughing. Then mechanism of cough. So in the mechanism of cough, the mechanism of cough is mainly brought, the cough occurs because of the contraction of the respiratory muscles. When the contraction of the respiratory muscles occurs against the closed glottis, this results in coughing. When there is contraction of respiratory muscles against the closed glottis, then on contraction of respiratory muscles against the closed glottis, this results in an increase in intracranial pressure, increase in intrathoracic pressure. This increase in intrathoracic pressure causes opening of the glottis with forced expiration. Thus, when the opening of the glottis occurs, then there will be forced expiration which occurs, leading to the cough. Types of cough. There are different types of cough. Uh, we have dry cough. Dry cough is seen in conditions like pleural disorders, interstitial lung disease, mediastinal lesions, product. So these are the three lesions where dry cough is seen. Dry cough is the cough which is not associated with sputum in dry cough, whereas the difference between the dry cough and productive cough is, in productive cough the cough is mainly associated with the sputum. Then the examples of the productive cough are: productive cough is seen in suppurative lung disease, chronic bronchitis, pulmonary tuberculosis. Then we also have short cough. In short cough, there is a small amount, the cough is very short and it is seen in common cold or in conditions with upper respiratory tract infections. We see short cough. Then we have brassy cough. Brassy cough is if the cough is associated with the metallic sound, then it is brassy cough. So when the cough is associated with metallic sound, this will cause compression of trachea. So the metallic sound is occurs because of compression of the trachea by some space occupying lesions. When there is some space occupying lesions in our lungs, so these space occupying lesions which were there, they will compress the trachea. So if this is the space occupying lesions, so these space occupying lesions will compress the trachea, resulting in some metallic cough when the expiratory air passes through it. So that is brassy cough. Then fifth type is bovine cough. In bovine cough, there is loss of explosive nature is seen in the cough. So in bovine cough, the cough does not have that force is not there in the cough. So this mainly occurs whenever the tumor presses the recurrent laryngeal nerve. Then we see this bovine cough. Then we have prolonged or paroxysmal cough. This prolonged or the next type is prolonged cough. So in the prolonged cough is also called as paroxysmal cough. This prolonged cough or paroxysmal cough is mainly present in chronic bronchitis. This prolonged cough or paroxysmal cough. This prolonged cough or paroxysmal cough is present in chronic bronchitis. Then we have barking cough. Barking cough is found whenever there is epiglottic involvement is seen in hysterical or nervous individuals. Then we see this barking cough. Then we have cough syncope or post-tussive cough syncope. That is, cough syncope is if the patient develops syncope after coughing for a long period of time, then we call it as cough syncope.
thank you and thank you for watching.